In our study of people with severe mental illness in South Asian countries, we found that people who ate at least 5 fruit and vegetables a day had 2.5 times greater risk of being overweight or obese. Severe mental illness, or SMI for short, is a term used to describe a number of different conditions including schizophrenia, bipolar disorder and severe depression. We know that people with SMI die on average 10 to 20 years earlier than the general population, and research suggests that a lot of this is down to people being obese. We think that people with SMI from low and middle income countries are at an even greater risk of obesity, but a lot of the research in this field is actually from higher income countries. The aim of our study is to fill this gap in knowledge and to try and understand more about obesity in people with severe mental illness in the developing world. A total of 3,989 participants agreed to take part in our study, and they came from Pakistan, India and Bangladesh. We measured their height, weight and waist circumference, and also did a survey to collect other important pieces of information like their age, gender, job, income, other health conditions, and also information about smoking and drinking habits. We used their height and weight to calculate their BMI, and then carried out some statistical tests to try and find out if there was any association with a very high BMI, or obesity, and any of the other factors we've mentioned, to find out how strong this link could be. Our study found that 17.3% of participants were overweight and 46.2% of participants were obese. We found that the risk of obesity was more than double in women with SMI compared to men with SMI. And we also found that there was a 37% greater risk of being obese in the highest income category compared to the lowest income category. But one of our most interesting findings was that those who ate more than 5 fruit and vegetables a day had 2.5 times greater risk of being overweight or obese. Now, we're not sure about the exact reasons for this, but we think it might be due to the fact that people who can afford more fruit and vegetables tend to eat more food in general, including unhealthier foods, which inevitably leads to weight gain. Now, this is in opposite to what we might see in developed countries where people with less income can't afford healthier foods and tend to be more overweight. These findings highlight the burden of obesity on people with SMI in these countries, and it has also helped to identify the groups most at risk of obesity, which means that governments and health services can prioritise their help towards these people and maybe even increase the life expectancy of people with SMI in South Asian countries.